active involvement in the management of diabetes is very, very important. Without your active involvement, all these are waste. So self-testing, self-adjustment of insulin dosage, that is titration of insulin, is very, very important in the long term for achieving your target sugars. So just like that continuation of same dose of insulin till next visit, maybe after 3 months, don't expect any miracles. Sugars will be like that only. So self-testing and adjustment is very, very important. And one more thing is common error. What we see is that site of injection. So ideal site is abdomen, avoid midline, from here to here, anywhere you can. Next to preferred site is thighs, front side or outside, don't take it inside, and keep on changing the site. This is very, very important. So if you repeat the injection at the same site, it is painless and useless. Keep on changing the site. So site rotation and dose changing, both are equally important for long-term good control of sugars. Again, insulin, we have basal, prandial, basal bolus premix. Means basal is one-time insulin. So for some period, along with tablet, we use this one-time insulin. Maybe after 5-6 years, you may require some addition. So that time we go for combinations. Next, coming to complications, why to treat diabetes? So there are some expected complications in the long run. Expected. So 3 pathis are important. Diabetic neuropathy, involvement of nerves, retinopathy, that is involvement of eye, and nephropathy, involvement of kidney. Very, very common. So any corporate hospital you go, if you see diabetic patient, at least one complication will be there, either neuropathy or retinopathy or nephropathy. So dialysis centers always busy with diabetic patients. And we have Dr. Vinod, neurophysician. He knows the importance of diabetes control in his clinic. The tingling, burning, shock-like sensation. So these are all signals for like a cry of dying nurse. So body gives so many signals for controlling your sugars. If you neglect that, then they will land in negative complaints. Means without your knowledge, you will lose the chappal, loss of sensation, not able to feel hot and cold sensation. These are all negative symptoms. So that is gone case. So positive symptoms like shock, burning, all those are reversible stage. Once they land in negative symptoms, we cannot do anything. Next, for diabetic patients, now we are focusing more on protection of heart and kidney. So ultimate aim is to prevent these risks. Okay. So there are some medications which will reduce the heart and kidney risk, like this molecule. SGLT inhibitor means flozins, dapagliflozin, empagliflozin, all those things. And GLP-1 based therapy means this Ozempic, Mounjaro weight loss medications. Basically, these are diabetic medications with additional advantage of weight loss. So just now I mentioned obesity is the root cause. It is like a trunk of the tree with so many branches in the form of diabetes, hypertension, cholesterol, snoring, osteoarthritis, infertility, PCOD. All these are part and parcel of obesity. So by giving this molecule, we are addressing the root cause of the problem. Next, there are some emergencies related to diabetes. So 2 types of emergencies are there. Low sugar related emergency, that is hypoglycemia, and high sugar related emergencies. Again, there are 2 conditions, diabetic ketoacidosis and HHS. Hypoglycemia, at one point of time, every diabetic patient will face that problem. So recurrent low sugars are not good. While you are driving, one single episode of hypoglycemia is enough to crash, accident. And one single hypoglycemia is enough to trigger cardiac rhythm problem. And those who are already facing problem of fits, epilepsy, so that low sugar can trigger that problem. So repeated low sugars are not good. And high sugar, that diabetic ketoacidosis, so that is like an emergency condition. So there is no choice, you have to admit. But for everything, you have some underlying reason. So try to identify and overcome. For example, hypoglycemia, delaying lunch or delayed some dinner, you are going to some attending one function, so social embarrassment, you will wait, instead of 1 o'clock you will take it at 3 o'clock, meanwhile you may face that problem. So decay is high sugar emergency. Most of the times infections are the reason, either urinary infection or lung infection. So with that background, sugars will spike and you will land in emergency. So any admitted patient, insulin is the drug of choice. So first we control the sugar with insulin. Once it is stabilized, at the time of discharge, generally we go back to the original medicine. Coming to technology, so we have so many things, from glucometer, self-monitoring of blood glucose with glucometer, CGM, I think majority are aware. So they'll stick over this arm. So continuous glucose monitoring. So you can see your values in a mobile. Your parents, your kids' sugar readings you can monitor in your mobile. That is continuous glucose monitoring. Next we have insulin pumps. So that is automatic delivery. Smart pens are not available in India. So insulin pump, so it is like an artificial pancreas. So this CGM will sense the glucose, that gives the signal to the pump. So it is like an automatic delivery. Only thing is you have to monitor the pump. Pump is costly affair. So machine itself will cost around near to 4 lakh, and maintenance will be around 15 to 20,000 per month. And so fixing that pump and forgetting is not correct. Sometimes technical glitches will be there, like overrunning of pump, you may land in low sugar. Underrunning of pump, you may land in diabetic emergency. So basic knowledge is must. So this is automated insulin delivery, that pump CGM algorithm. So all predefined values will be there. Like for example, if sugar goes less than 70, switch off. If it goes more than 180, some overdosing will be there. So that is automatic delivery. So this instrument behaves like a artificial pancreas. There is a future. So this is weekly once insulin, recently introduced into the market. So it is not suitable for all individuals. So those who are having too much fear of insulin, prick phobia, so and requiring minimal dose of insulin like 10 units per day. So for that type of patients, weekly once definitely we can. So instead of 10 units per day, with this 70 units per day, 70 units per week we can. No relation to food, anytime, but try to take it at the fixed time. So every week you can titrate the dosage, 70, 80, 90, maximum 700 units at a time you can. But that pen is different. It is not like a routine insulin pen. That pen is different. So future of diabetes care. So with this latest artificial intelligence, we have smart pens that it will give reminder for your food, breakfast, lunch and dinner timings, and dosing, and automatical entry of your glucose reading into that pen. But ultimately, whatever may be the advancement in technology, whatever may be the advancement in medication, ultimately lifestyle change is very, very important. So with good lifestyle, you can prevent or postpone the onset of diabetes. So diabetes is treatable, not curable. That you must remember. Thank you.